Hello everyone. Welcome to another episode of Bone Doctor. For last few episodes, I've been talking about the dangerous disease called diabetic foot. In this episode, the most important episode, I'm going to discuss how can we prevent a diabetic foot and how can we treat a diabetic foot. Because as we all know, diabetic foot is the leading cause of amputations in India and Southeast Asia, and also a major cause of amputation in all over the world. So it is the need of the hour to prevent and treat a diabetic foot. So coming to prevention of diabetic foot. The most obvious thing about diabetic foot is uncontrolled chronic long-term diabetes. So if you are a diabetic patient or if your loved ones is suffering from diabetes, make sure that he gets his diabetes blood sugar levels checked every 3 months, and if it is out of hand, means out of the range, that is if it is greater than 200, then make sure that you consult your doctor to keep it well below control. There are many other methods also, such as exercise and dietary methods to control diabetes. I'm not going to the detail of that because that's a total different video altogether. Today I'll be discussing about diabetic foot and its prevention. Take good care of your foot. What do you mean by good care? Prevent any injuries to the foot. Wear good, soft, protective footwear whenever you are running or going for a walk or even walking around in the home. Footwear is of utmost importance in a diabetic person. It should be soft, it should be well padded. Check your footwear whether it has lost its softness or not, because using a footwear for long periods of time may lead to wear and tear of the footwear, leading to hard points, and hard points in a diabetic foot will lead to callus formation in the foot, and callus formation are the starting point of diabetic foot ulcers. So check your footwears regularly. Check for any stones or any object in the footwear whenever you are wearing the footwear. It is obvious that the shoes may have a stone inside it or may have some pin or any other thing inside the shoe. A diabetic patient who is suffering from peripheral neuropathy has lost his or her sensation of the foot. So whenever he is wearing such footwear and a stone sticks inside his footwear or shoe, it causes enormous damage and ulcer to the foot, which he is totally unaware of. So always check for the shoes. Wear soft shoes. Take good care of the foot, that is, apply various petroleum jellies, so ointments, so that you keep your foot soft and supple. Check for ulcers of the foot. We know diabetic patients develop ulcers without even his knowledge because he has no sensation of his foot. So check for any cracks or any small ulcers in the foot. Check for foot infections. That is, sometimes we have small infections of the nail bed, infection inside our in the finger, in the toes. There we have. These infections in a normal person doesn't cause a lot of harm, but if he is a diabetic, these small infections may flare up very soon, leading to a diabetic foot ulcer or diabetic gangrene. Regularly do a checkup to your doctor. He will suggest you to some podiatrist who will check the foot sensations. We check foot sensations by various nerve probes, by various vibrating tools. Check for the sensation of the foot, whether it has lost its vibration sense, whether the sensations are intact or not. Color Doppler and other tests are performed to check for the arteries of the foot. The arteries are mostly clogged. There are atherosclerosis of the arteries of the foot, which is due to diabetes. Check for the proper blood supply is occurring in the foot or not, so that we can take preventive measures before a diabetic foot ulcer sets in. If you are having an ulcer, contact your doctor, and as he suggests, take good care of the foot by applying various antibiotic ointments. If the doctor prescribes, take antibiotics. Check for foot fractures. X-rays must be done. X-rays helps us to detect the osteoporosis in the bones, whether the bones are suffering from calcium deficiency, and it also helps us to detect unknown fractures. In diabetic foot, as the foot sensations are lost, bone pains are also reduced comparatively. So the person may suffer from fractures and he may not understand it, or he may not know it. So X-rays are of paramount importance, which will help us to understand early fractures so that it doesn't lead to more fractures and more joint damage. These are the ways by which you can prevent a diabetic ulcer, foot ulcer. Now let's understand, if you have developed a diabetic foot ulcer, or if you have a diabetic gangrene, how we treat that patient. Whenever a person comes to us with a diabetic foot, that is having a diabetic gangrene, infection in the foot, there is infection which is involving the foot bones, muscles, and there's a huge ulcer on his foot, how we treat those patients? First of all, we give insulin and we start antidiabetics so as to rapidly decrease his blood sugar level and bring it back to normal. Because before we start the treatment, diabetes should be in the normal state, as the blood sugars should be at the normal. Without that, we cannot proceed in the treatment. Secondly, we give him some antibiotics. We do regular dressing of the ulcer. Orthopedic surgeons, general surgeons take part in regular debridement and cutting out the bad tissue, unhealthy tissue, any gangrenous stores, we cut it off so that the healthy tissue remains and the healthy tissues are not affected by the gangrenous portions. We use total contact cast. That is a type of casting mechanism by which all of the foot is kept in contact. With that, we allow the patient to walk. Total contact cast helps to distribute the forces of the foot, the body weight to be equally distributed through the whole foot. So the ulcers doesn't develop a particular part, or callus doesn't form in a particular part. If there are callus, if there are hard points which are developed, we try to smoothen it up. If there is a bony hard point, we try to brush it out or cut it out. This is how we take care of a diabetic foot. Regular dressings and a strict diabetic control helps us to achieve disease-free and infection-free foot after a treatment of around 2 to 3 months. Diabetic foot, if it happens, the treatment is prolonged. Rarely, in few cases, diabetic foot proceeds to such a degree that it affects the whole foot and the whole foot is infected and gangrenous. In such cases, we have to perform amputation of the foot and mid-leg, through the mid-leg, below knee amputations to save the life of the patient. After that, we give him prosthetics to walk and we keep him under strict observation about his diabetes and the other foot and the other leg, so that that also doesn't develop a gangrene and ultimately amputation. So this is how we treat a diabetic foot. Hope I have given some information and some picture of prevention and treatment of diabetic foot. If you find it informative, do share it with your friends, and if you like my channel, subscribe it for more videos like this in future. So bye bye for now. Take care.